Welcome to your personalized deep dive, everybody. We're cracking open those post-surgery instructions from Dr. Katsevman, the ones they send you home with after surgery, all those do's and don'ts. Well, today we're going to decode those, make sense of all that medical jargon.
That's like we've got this treasure map, and instead of X marks the spot, it's X marks feeling better.
I like that. A treasure map for recovery.
Sure.
And the first landmark on this map, pain management. All right.
Absolutely.
Dr. Katzevman's instructions, they dedicate a whole section to this, and it's not just about popping pills, is it?
Nope, it goes way beyond that. It's about recognizing that pain after surgery, it's normal, but it's different for everyone. See, Dr. Katzevman, he lays out this really smart approach, tackles pain from multiple angles.
Okay, so let's break that down. What's that first line of defense on our treasure map?
Well, you've got your prescribed pain medication, of course. That's going to be, the heavy hitter, especially in those first few days after you're home. But then, to kind of manage things in between those doses, Dr. Katzevman recommends alternating Tylenol and muscle relaxers, something like Robaxin.
Okay, interesting. Why the combo approach?
So sometimes those pain meds alone, they're just not enough. Muscle relaxers like Robaxin, they can be really helpful, especially if you're having muscle spasms. And believe me, those spasms are common after spinal surgery. And Tylenol, well, Tylenol is great for that general achiness and inflammation.
Gotcha. So it's like a, multi-pronged attack on pain. I'm noticing a theme here, proactive, not just reactive.
Exactly. It's about staying one step ahead, which brings us to something nobody enjoys discussing.
Uh-oh, what's that?
Well, those instructions, they tackle it head on, no beating around the bush constipation.
Ah,
It's one of those side effects of pain meds that nobody wants to deal with on top of recovering from surgery.
I feel that for sure. Okay, so how do we swerve around that particular roadblock on the road to recovery?
Well, Dr. Katzevman, he's got us covered there too. He recommends staying ahead of the game with tool softeners. It's so much easier to prevent that discomfort than to play catch-up later on, trust me.
Good advice, for sure. Okay, what about those everyday anti-inflammatories, like ibuprofen? I practically live on those for regular aches and pains, but I see these instructions mention waiting a full 12 weeks after a fusion surgery.
That's a really important point. You see, ibuprofen, it can actually mess with bone healing, and that's the whole goal with fusion surgery. So for those first 3 months, you really want to avoid anything that could potentially slow down that process.
So if you had a different type of surgery, like a decompression or a disc replacement, you'd be good to go with ibuprofen?
Generally, yes, unless your doctor has advised against it because of other medical reasons. But for fusion, yeah, it's a big no-no for those first 12 weeks. And, this is a perfect example of why these personalized instructions are so important. What works for one person might not be right for other.
Absolutely. Okay, I have to ask about this next part. The instructions mention something called rebound zingers. And honestly, that name alone has me a little freaked out.
I hear you. It's not the most comforting term, is it? Basically, what they're talking about are these brief, sharp pains that can sometimes shoot into your arms or legs. Imagine it like this. You know how your foot can fall asleep and then when it wakes up, it kind of tingles? It's kind of like that, but in your nerves.
So these rebound zingers, that's just our nerves waking up after surgery.
Precisely. And just like that tingling in your foot, it's temporary. Most people find that those zingers, they settle down within a couple of weeks.
That's reassuring to know. But I imagine if they stick around longer than that, definitely reach out to Dr. Katzman's office, right?
Absolutely. It's always better to err on the side of caution. And speaking of caution, let's shift gears a bit and talk about driving, or rather, not driving after surgery.
Makes sense, yeah. Probably not the best idea to jump behind the wheel right after surgery. I mean, it seems like a pretty basic thing, but there are a lot of reasons why that could be risky, right?
You got it. For starters, your reaction time might be a little off. You could get tired more easily than usual, and those pain meds we talked about, they can definitely cloud your judgment.
So yeah, no driving right away. Makes sense. But the instructions also mention waiting a full 72 hours, even if you're not taking opioids.
Right, because there's another risk that we need to be aware of after surgery, blood clots.
Yeah.
And sitting for long stretches, it can actually increase that risk. So even if you're feeling pretty good, those first few days are really about easing back into things.
Which is where those long car rides as a passenger come in, even if you're not the one behind the wheel. It's still important to be mindful, right?
Exactly. See, those instructions, they're not just about what you can and can't do. They're about understanding the why behind it all. Like if you are on a long car ride, make sure to take breaks to stretch, walk around a bit, keep that blood flowing.
Gotcha. So Dr. Katzevman wants you moving even when you're stuck sitting still.
Absolutely. And speaking of moving, there's one activity that Dr. Katzman, he's a huge fan of for recovery: walking.
Yes. Walking is mentioned everywhere in these instructions. It's like the magic bullet of recovery or something.
It practically is. Walking helps to get that blood flowing, which brings oxygen and nutrients to your healing tissues. It also helps prevent those pesky blood clots we were talking about. Plus, it gently strengthens your muscles. You know, the ones that might have gotten a little weak while you were recovering.
Yeah, it makes sense. Your body's been through a lot. So even though it's low impact, walking packs a powerful punch when it comes to bouncing back. But what about other activities like lifting things? Are there any restrictions there?
You bet. Those instructions are really clear about weight limits, especially in those first few weeks.
Right. So how much weight are we talking here? Like, what's the magic number?
So for the first 2 weeks after surgery, try not to lift anything heavier than 10 to 15 pounds.
Yeah.
That's roughly the weight of a gallon of milk. So think of that as a good visual reference.
Oh, okay. So those grocery bags are definitely off limits for a while.
Exactly. And even after those first 2 weeks are up, the timeline for getting back to your normal lifting routine, it really depends on what type of surgery you had.
Okay, so let's break that down a bit. Dr. Katzevman mentions decompression surgery, disc replacement, and fusion. What's the difference between those?
Okay, so imagine your spine is like a highway for your nerves.
Yeah.
Decompression surgery. That's like clearing out any debris that's causing a traffic jam, relieving that pressure on the nerves. Disc replacement, think of that like swapping out a worn-out shock absorber. You're replacing a damaged disc with an artificial one. And fusion is kind of like, well, fusing two sections of that highway together, permanently joining two or more vertebrae to stabilize the spine.
Wow, okay, that makes a lot more sense. So those different surgeries, they're going to have different recovery timelines when it comes to things like lifting and other activities.
Precisely. For decompression or disc replacement, you're typically looking at around 6 weeks before you're cleared for heavier lifting and, unrestricted activity. But for fusion, it's closer to 3 months.
Which makes sense because fusion is a much bigger change to the spine, right? It really highlights why it's so important to follow those personalized instructions.
Absolutely. See, those timelines are based on how long it typically takes for your spine to heal properly, and every single person heals at their own pace.
So true. Okay, so walking, good. Heavy lifting, not so much. What about things like, I don't know, bending over to tie your shoes? Is that a no-go?
That's where those instructions, they get super specific. They say to avoid bending or twisting at the waist for those first 2 weeks after surgery. It's all about protecting your spine while it's healing.
So it's time to break out those slip-on shoes or perfect the sock shuffle until you're in the clear, huh?
Or, call in a favor from a friend or family member. Those are always helpful. But seriously, those kinds of movements, even ones that seem really small, they can put unnecessary stress on your healing spine. Instead of bending from the waist, try bending at your knees like a mini squat to pick things up, or tie your shoes.
Oh, okay, good tip. What about reaching overhead? Like if you need to grab something from a high shelf?
For those first couple of weeks, it's best to limit those overhead activities as much as you can. Reaching up for short periods, like to wash your hair or grab something from a low cupboard, that's probably fine. But anything strenuous or prolonged, like hanging curtains or putting away groceries on a high shelf, you'll want to avoid those.
So no marathon cleaning sessions for a while.
Exactly. And remember, it's not just about what you're doing, it's how you're doing it. Pay attention to how your body's feeling, take breaks when you need them, and if you feel any pain or discomfort, stop.
Yeah, that's good advice. Listen to your body. It sounds like this is where being mindful really comes in handy. Paying attention to how your body feels and not pushing it too far.
Absolutely. Recovery isn't a race, it's a process, right? And those instructions, they're like that roadmap to help you navigate that process successfully.
Love that analogy. Okay, so we've covered pain management, activity levels, bending, reaching, all that good stuff. What about, I know, showering. I don't know about you, but those first few showers after surgery always feel amazing.
Oh, the best, right. And good news, you can usually hop in the shower about 48 hours after surgery, as long as your incision is clean and dry.
That is good news. What about washing your hair? Is that okay, or should that wait?
Washing your hair in the shower, yeah, that's totally fine. Just be sure to avoid, soaking or submerging the wound for at least 6 weeks.
Okay, so no long, luxurious baths or relaxing in a hot tub for a bit.
Exactly. And definitely no swimming for those first 6 weeks. I know it seems like a small thing, but water, it can harbor bacteria, and you really don't want an infection, believe me.
Yeah, that would definitely throw a wrench in the recovery plans. So no swimming or soaking. Got it. What about sleep? That's got to be crucial, right?
Absolutely. Sleep is prime time for your body to heal. And the good news is you don't need any, like, fancy equipment or special positions or anything.
So I can ditch that mental imprint of myself sleeping upright in a chair for the next 6 weeks.
You got it. The instructions say you can sleep in whatever position is most comfortable for you. The key is to prioritize getting good quality sleep.
Okay, that's a relief. But I imagine even in a comfy position, it might be tough to sleep soundly after surgery, right?
Oh, absolutely. It's totally normal to have some sleep disruptions, especially in those first few weeks. Your body's adjusting, you might have some discomfort, and the pain medication can sometimes mess with your sleep patterns.
Makes sense. Anything in those instructions specifically for people who have a brace?
Ah, yes. If Dr. Katzman has prescribed a brace, usually for a fracture or a fusion, those instructions are definitely your new best friend. You'll want to wear it whenever you're up and moving around. Think of it as extra support for your spine while it heals.
Oh, okay, so it's like a little scaffolding for your bones.
Exactly. And a little pro tip, they recommend wearing a shirt under the brace to prevent any rubbing or irritation.
Good to know. Comfort is key, especially during recovery. And you can take a break from the brace when you're showering, right?
Absolutely. Keeping the area clean and dry is important, so yeah, shower time is brace-free time. And speaking of showering, remember those restrictions on soaking the wound. Those are super important, especially during those first 6 weeks.
Right, no baths, hot tubs, or swimming until Dr. Katzevman gives you the green light.
Exactly. I know it might seem like a long time, but trust me, those restrictions are temporary, and they're there to help you heal properly and avoid any complications.
It's like anything else worthwhile in life, right?
Hmm.
A little bit of patience and discipline in the beginning pays off big time in the end.
Love that perspective. It's not about deprivation. It's about setting yourself up for success in the long run.
Well said. We've covered so much ground today. From managing pain to understanding activity levels to even those small, everyday things that take on a whole new meaning after surgery. But the biggest takeaway for me is that those post-op instructions, they're not just a list of rules, are they? They're more like a roadmap to a smoother, faster, and honestly, a less scary recovery.
And the best part, you're not alone on this journey. Dr. Katzman and his entire team, they're there to support you every single step of the way. So never hesitate to reach out if you have questions, if something doesn't feel right, or even if you just need a little reassurance.
Absolutely, you've got this. And here's a little something to think about as you're recovering. We've talked a lot about what you can't do after surgery, but what about focusing on what you can do? Maybe it's finally reading that book that's been sitting on your nightstand for months, or catching up with friends and family, or just, giving yourself permission to rest and recharge. Use this time to really prioritize your well-being, both physically and mentally.
Such a good point. Recovery isn't just about your body, it's about your mind and your spirit too.
Exactly. And remember, you're not defined by this surgery, by this recovery. You're strong, you're resilient, and you've got this. That's it for our deep dive into Dr. Katzevman's post-surgery instructions. We hope you found it insightful, empowering, maybe even a little fun, and we wish you a smooth and successful recovery.